Mr. Speaker, the recent exponential rise in cases has impacted our healthcare capacities. Currently, about 15% of hospital beds in the acute public hospitals are used for around 10% of all COVID-19 cases. Those requiring oxygen supplementation or ICU care account for 2% of total cases, most of whom are unvaccinated or the elderly. In the last 3 months, ICU bed occupancy has increased from 26% to 53%. The occupancy of isolation beds has risen from 58% to 86%, while the occupancy of community care facilities, CCF beds, has gone from 10% to 35%. Public hospital emergency departments have seen up to an 8-fold increase in the number of patients with ART or PCR positive results seeking medical attention. Prior to the last 14 days, we conveyed COVID-19 patients above 70 years old to the hospital within 12 hours from the time they had a PCR positive test. With the current high caseloads, we are now taking, on average, between 48 to 72 hours to do so. SCDF ambulances are reserved for patients with emergency conditions. Hence, MOH has set up a dedicated fleet of 95 additional ambulances to convey COVID-19 patients to the different healthcare facilities. We are taking steps to expand our hospital and treatment resources to ensure that everyone who requires medical care, whether for COVID-19 or other conditions, will receive it. We've asked hospitals to prioritize resources for COVID-19 patients by reducing non-essential elective appointments. We've been shifting asymptomatic and lower-risk COVID-19 patients from the hospital to COVID-19 treatment facilities, the CTFs, as well as the CCFs and the home recovery program. These allow acute hospital resources to be focused on managing patients who need urgent or essential care. We are closely monitoring the ICU trends in particular. We've increased the ICU bed capacity by 74 beds for a total of 187 beds dedicated to COVID-19 patients with severe conditions. More ICU beds can be opened on short notice if needed. We are also closely monitoring the hospital manpower situation, given that close to 400 healthcare workers have tested positive for COVID-19. Our hospitals will continue to dynamically cross-deploy their resources to ensure that our manpower needs are met. We're also working with private healthcare providers to augment our manpower. To further preserve our healthcare capacity in the face of future waves of infections, we must also adopt more sustainable healthcare protocols based on the medical care required. The vast majority, over 98% of infected individuals, have mild or no symptoms, and only 0.3% have needed ICU care or who have sadly passed on. This is a result of having vaccinated most of our population, who will only experience a mild illness if they suffer a breakthrough infection. Thus, we are making home recovery the default protocol for infected individuals, unless they have severe symptoms, are elderly, or have underlying comorbidities that make them more susceptible to severe disease outcomes. Besides focusing our hospital and medical treatment resources on those who need it most, we are also ensuring that our COVID-19 response systems are directed appropriately. We will continue to use technology, such as the Trace Together and Safe Entry systems, to automatically and quickly identify the majority of close contacts and to prompt these contacts to self-monitor and take precautions against unknowingly infecting others. This process augments our efforts and allows us to focus the work of the 350 full-time contact tracers that we have today. We must optimize the deployment of these officers. As cases have increased multiple-fold in the community, it's not always useful to comprehensively contact trace around every case detected by conducting extra interviews and manual case detection. Instead, we are focusing these intensive contact tracing efforts on cases and clusters detected in vulnerable settings, like hospitals, nursing homes, and schools. These are areas where contact mapping and comprehensive identification of close contacts have the greatest public health benefits today. Individuals who are tested positive have been asked to self-declare their household members so that they can be placed under quarantine. What we are doing is calling on the self-responsibility of our people to aid our officers and aid our efforts. Next, if I may speak on our quarantine and isolation operations. The QO and stay-at-home notice processes are administered by around 300 officers from MOH and the Immigration Checkpoints Authority, ICA. These officers handle around 6,700 daily queries on average on issues such as the quarantine status, quarantine conveyance and testing, as well as the quarantine order rescindment requests. While such queries should be resolved within 3 working days, the current surge has resulted in some, especially the complex ones, taking longer to resolve. This also increases the waiting time for others before their calls can be connected, even if their queries are not as complex. We will continue to enhance the resourcing to manage surges and seek the public's understanding for longer response times during this period. We have put out more public communications material in print media and on our websites so that individuals affected by COVID-19 can potentially self-help themselves as well as their families and their friends. We will continue to scale up the home recovery program. This ensures that our hospital and medical treatment resources are prioritized for those who are or could be severely ill. We've also adjusted our QO regime to allow individuals who are less likely to fall severely ill with COVID-19 and whose homes are suitable for home recovery to quarantine at home. This regime places the responsibility on the confirmed COVID-19 cases and their household members, including minors and caregivers, to self-register. After the original quarantined individual is confirmed to have COVID-19 and has been served an isolation order, the other household members should self-register for quarantine as well, in order for the whole family to recover and be quarantined together at home. We will also increasingly allow fully vaccinated travelers who need to serve a stay-at-home notice to do so at home. Currently, such travelers from Category 2 and Category 3 countries may already apply to serve their SHN at their place of residence or other suitable accommodation that they have secured. Almost all travelers from Category 2 countries and around half the travelers from Category 3 countries fulfill the criteria and have opted out of the dedicated SHN facility. We will progressively review and adjust our border measures, but for now, fully vaccinated travelers from Category 4 countries must still serve their SHN at the SHN dedicated facilities. Those serving the home quarantine or home SHN are also given information on transmission prevention, including isolation protocols and good personal hygiene practices. ART kits are provided to household members for them to monitor their own health. Those on home isolation requiring dedicated care arrangements may also apply for assistance ahead of or during the SHN. Vulnerable persons serving an SHN or QO who need support for their activities of daily living, such as minors and the disabled, may also be accompanied by a caregiver. We will continue to review our protocols and measures. There is a financial impact to businesses and individuals whose livelihoods are affected by QOs. Between January and September this year, around 3,300 point-to-point drivers, P2P drivers and riders have been placed on a QO. These individuals, along with others whose livelihoods have been affected by these QOs, can apply for a QO allowance to help cushion the financial impact. Mr. Speaker, the public health actions that are triggered upon confirmation of a COVID-19 infection for an individual are disruptive, but it remains important that we detect possible COVID-19 infections early so as to minimize the impact of transmission to their loved ones at home or to their friends or colleagues. There are some who have a misconception that we are testing widely to attempt to eliminate the virus. This is not so. We have many community cases around us. Our widespread testing aims to reduce the overall rate of transmission from each COVID-19 infection, slowing the spread in the community. ART testing also enables individuals to perform self-testing and do our own part to slow down this transmission of the virus. These strategies will allow us to ride the wave of infections without overwhelming our healthcare and public health response resources. To this end, regular testing in the workplace and at home remains key. We have made ART test kits widely available through sale at major retailers, free through nationwide household distribution, and supplying kits to companies for mandatory routine testing regimes or voluntary regular testing. Individuals who are exposed to the virus and issued health warnings or alerts may also collect ART kits for regular self-testing from our vending machines island-wide. To make these test kits on sale more competitively priced, we are actively reviewing new brands of equally effective kits to bring into the market. We will also evaluate if there is a need to conduct another round of nationwide household distribution of kits to support regular self-testing. These fast and easy tests have been effective in augmenting our case identification efforts. Of the total COVID cases identified in the last 8 weeks via the PCR test at swab and send home or SASH clinics, 7% had initially tested positive using the self-test ART kits before coming forward for their confirmatory PCR tests. Sir, as we move towards living with COVID-19, each of us must play our part to lower transmission risks and slow the pace of community infections. While the government will continue to make adjustments to augment our healthcare and public health response capacity, all of us need to be socially responsible, take care of ourselves and others around us through regular testing and adherence to isolation protocols if we have been exposed to positive cases. Continued adherence to our safe management measures will also help to dampen the rate of transmission. This is what it means for us to work together to be a COVID-resilient nation. Thank you, sir.